Welcome to Microscopic Marvels. Today, we're going to dive deep into the hidden world of a really fascinating and frankly globally important parasite. All right, so here's our game plan. We're going to explore Ascaris lumbricoides, the giant roundworm. First, we'll meet the parasite itself and learn how to identify it. Then, we'll follow its incredible journey through the human body, see what kind of symptoms it causes, figure out how we diagnose an infection, and finally, wrap up with how to treat and prevent it. So first things first, let's meet this giant roundworm. In this section, we're going to focus on its morphology. The key features you'll absolutely need to recognize for your exams. So what exactly is Ascaris lumbricoides? Well, it's called the giant roundworm for a reason. It is literally the largest of its kind to set up shop in the human intestine. You'll also see it called a soil-transmitted helminth, and that name tells you exactly how it gets around, from the environment right into a person. Okay, and here's where it gets super important, especially for those of you with exams on the horizon. The key to diagnosing an Ascaris infection is actually finding its eggs in a stool sample. But there's a catch. The female worm makes two totally different kinds of eggs. This table lays it all out beautifully. Take a look at the fertilized egg on the left. It's round to oval, and it has this thick, bumpy coat. We call that memelated. Inside, you've got a clear, unsegmented ovum. Now, the unfertilized egg is a whole different story. It's longer, narrower, with a thin, kind of distorted coat and a shrunken-up ovum. Now for the crucial viva point. If you put these in a salt solution, the fertilized egg floats, but the unfertilized one sinks. That is a game changer for diagnosis in the lab.
Okay, so we know what the eggs look like, but how do they actually cause an infection? In this next part, we're going to trace the unbelievable, complex journey this parasite takes all the way through the human body.
So, how does this all begin? It starts when someone swallows embryonated eggs. Once they hit the small intestine, they hatch. But the larvae don't stay put. Nope. They burrow through the gut wall, hop into the bloodstream, and basically take a road trip through the heart and into the lungs. In the lungs, they grow and molt inside those tiny air sacs, the alveoli. Then they climb up the respiratory tract to the throat, get swallowed for a second time, and end up back in the intestine to finally become adult worms. What a journey! And once those adult females are settled in, they become absolute egg-laying machines. A single female can produce a jaw-dropping 200,000 eggs every single day. This massive number is exactly why ascariasis is so common in places with poor sanitation. So what does this infection actually look like in a patient? That brings us right to the clinical picture. The symptoms a person gets really depend on where the parasite is in its life cycle. Are we talking about the migrating larvae or the full-grown adult worms? Let's break this down. In the second week, as the larvae are cruising through the lungs, a patient might get a cough, a fever, maybe some chest pain. But the adult worms, they cause a whole different set of problems down in the intestine. A few worms might not cause any trouble, but a heavy infection can lead to malnutrition as they steal vital nutrients. In really severe cases, a huge ball of worms can actually block the intestine. Or individual worms might go exploring, we sometimes call it wanderlust, and that can cause serious issues like blocking the bile duct. And that brings us to an exam favorite, Loeffler syndrome. This is a kind of pneumonia where you see a big spike in eosinophils, a type of white blood cell, all thanks to those migrating larvae. For your MCQs, you have got to remember this classic triad. 1, difficulty breathing. 2, patchy shadows on a chest x-ray that seem to move around. And 3, a high eosinophil count in the blood. That combination is a huge red flag for a parasitic lung infection. Okay, so with all these symptoms, how do we actually confirm it's Ascaris? In our next section, we'll look at the key diagnostic tools, from what we do in the lab to what we can see on medical scans. The gold standard, no surprise, is finding the eggs in a stool sample. But here is a critical Viva tip. The method you use really matters. Sedimentation techniques are way better than flotation. Why? Well, remember how we said those unfertilized eggs are heavy? They don't float. So if you only use a flotation method, you could totally miss the diagnosis. Now, when there's a really heavy worm infection, imaging can give us a crystal clear picture. A barium meal x-ray can show the adult worms hanging out in the intestine. They create this really unique pattern that looks like parallel lines. We call them trolley car lines. It's a super distinct sign, and once you see it, you won't forget it. All right, we know how to find it. Now, how do we get rid of it? Let's move on to our last section, treatment and prevention. We'll cover how to manage an active infection and, just as importantly, how to stop it from spreading in the first place. The good news is treatment is usually pretty straightforward and effective. The go-to drugs are albendazole or mebendazole, usually just a single dose. And for pregnant patients where those drugs might not be ideal, pyrantyl palmoate is a safe and effective alternative. But really, at the end of the day, prevention is everything. Because this is a soil-transmitted parasite, the best strategies are all about public health. This means proper sanitation to keep human waste out of the soil, promoting good personal hygiene, like washing hands, and making sure untreated human feces aren't used as fertilizer. These are the steps that actually break the cycle. And that wraps up our tour of Ascaris lumbricoides. We've covered its identity, its wild journey, and how we fight back. If you like this video, then please like, comment, and subscribe.